Good evening from New York, and welcome to this Arthritis Power and Creaky Joints hosted informational webinar titled The Two Ps of Arthritis Treatment, Why You Should Care About Precision and Personalized Medicine. I'll just go over a few housekeeping rules before we can get to the interesting part. So everyone in the audience is on mute, and the reason we do this is because we're also recording this webinar to enable those who aren't able to join us live to access this webinar later. We do encourage you to send us your questions throughout the course of this webinar. So please use the chat box that you should see on your panel, on your screen, to send us questions at any time during this webinar. We will try our very best to answer all of your questions, but please keep in mind that we do have 1 hour, so we'll try and answer the questions to the best of our ability. Arthritis Power of the Global Healthy Living Foundation has been conducting these webinars now for over a year. My name is Shilpa Venkatachalam, and I will be facilitating tonight's webinar. I am the Associate Director of Patient-Centered Research at the Global Healthy Living Foundation, and also the co-principal investigator on Arthritis Power, which is a patient-powered research registry for patients with all kinds of arthritis. Arthritis Power is also a tracking app to help patients keep track of their disease. So one of the goals of these webinars that we've been now conducting for well over a year is to share with patients like you cutting-edge research and information on rheumatic and musculoskeletal disease. With that, I'm delighted to introduce our speaker for today, Dr. Daniel Hernandez. Dr. Hernandez is the Medical Advocacy Liaison for the Global Healthy Living Foundation. He graduated medical school from the Universidad de Guadalajara and is now based in New York City, where he leads medical education and Hispanic outreach across all disease states for Global Healthy Living Foundation. He has previously presented a webinar, which some of you may have attended, on arthritis drugs and how they work. If you haven't attended this webinar and if you're interested on the topic, this webinar, like many of our others that were previously conducted, are now accessible on the Creaky Joints website. So today's webinar is titled The Two Ps of Arthritis Treatment, Why You Should Care About Precision and Personalized Medicine. We will discuss what these terms mean and the role that they play in treating autoimmune diseases. So I'll just give a little more context to the webinar, and then I'll hand over to our expert for today, Dr. Hernandez. Research advances may soon help us tailor specific treatment plans based on the information that we're getting from blood work, lab work, genetic testing. In addition, an individual's experience with the disease, along with their values, goals, and preferences, can help us tailor specific treatments for specific individuals. Now, this is already happening today, and in fact, it has been applied to some diseases for many years now. But how can we understand this and apply precision and personalized medicine to autoimmune diseases like rheumatoid arthritis? I certainly can't answer that question for you, but I will hand over at this point to Dr. Hernandez to help us answer this. Welcome once again, and we hope you enjoyed tonight's webinar.
Thank you for having me, Shilpa. As you mentioned, today we're going to talk about personalized and precision medicine. I'm sure the majority of you have heard these terms before, and we have been getting questions from our community about the differences between them. And truthfully, even with professionals who use these terms daily, there seems to be quite a bit of overlap and confusion in what the differences are, if any, between personalized and precision medicine. And as we've been looking for the answers, we've seen that these terms are many times used interchangeably in studies and by different people. So what we're going to try to do today is try to define in a very simple way for our community and hope this can alleviate some of the confusion. The topics that we'll cover today will be what is personalized medicine, what is precision medicine, then we'll look at how they are different, followed how these can apply specifically to patients with an autoimmune condition, and finally, we will take questions. So before we begin, it's important to note that the terms that we're defining are specific for people with an autoimmune condition. Another reason why we have to make that distinction, that we're using these terms in the context of an autoimmune or an arthritis patient, is that since precision and personalized medicine refers to a person's treatment plan, we have to look at these depending on what condition we're talking about, because it will mean something very differently to a person facing a different condition. A very evident example of this is how these terms are used differently in cancer compared to arthritis, because of how these two present differently in patients. In cancer, if you need treatment, it usually depends on the type of cancer, its size, and whether it has spread. In rheumatoid arthritis, for example, there are other factors at play. Other than that, we can't see it physically to measure the size or other attributes. The same type of rheumatoid arthritis can affect different people in different ways. And to top that off, the same medication might react very differently on one person than it will to another. So the treatment plans between a patient with cancer and arthritis will be very different, and therefore the terminology, in this case precision and personalized medicine, will mean different things depending on this. So today we will focus on how these terms apply solely to arthritis patients. And to simplify this even further, because this is a very complex topic, and recognizing that when we say arthritis, there are hundreds of conditions that fall into it, we are going to speak about rheumatoid arthritis in the examples, keeping in mind that there are many overlaps between conditions. So, what does personalized medicine mean to an arthritis patient? Personalized medicine is everything that you speak to your doctor about. Basically, everything that doctors can't see in lab tests is personalized medicine. These are things like speaking about depression, anxiety, sleep disturbances, and many others. The way that this happens is by speaking to your doctor, but also by using more structured tools that your doctor can use to tailor your treatment plan. These tools can come in many forms, such as patient-reported outcomes, which are sets of questions that help you track different symptoms such as pain, fatigue, and many others over time. There are many ways to track these PROs, or patient-reported outcomes, like using an application, a mobile application such as our Arthritis Power app, which serves as a tracking app and a research registry as well. Patients can answer questions using this or an app like it and see how they are doing while on their treatment. This can then be shared with their doctors, and the doctor can then modify the treatment plan if something doesn't seem like it's going right, or keep a treatment plan if things are looking good. Other aspects that can fall under personalized medicine are the questionnaires that are usually administered in the doctor's office, such as the Rapid 3 questionnaires. I'm sure the majority of those listening have answered these questionnaires, but this is a brief questionnaire used in a clinical practice that asks about the patient's physical abilities, pain, and health. And finally, personalized medicine takes into account what we at Creaky Joints are big advocates for, which is shared decision making. These are all of the conversations that you have with your doctor that leads to decisions about treatments and care plans based on what is important for yourself and for everybody involved. An example of this are the preferences you have in taking your DMARDs, which stands for disease-modifying anti-rheumatic drugs. We speak more in depth about these on another webinar that you can find in our website on creakyjoints.org called How DMARDs for Arthritis Actually Work in Your Body. And I would invite you to check it out after this. So now that we know what is involved in personalized medicine, how does this actually look like in real life? So now that, let's say that a person has been diagnosed with rheumatoid arthritis and that person starts tracking their symptoms and they're using something like Arthritis Power as soon as they are started on a treatment plan. After a few months, that patient can go to the doctor and the doctor starts seeing that the person is battling with sleep and pain. Actually, I'm going to pause here for a second and speak about a study we did using patient-reported outcomes through the Arthritis Power app. And the study focused on the relationship between pain, sleep disturbance, and fatigue. And what we found was that all three played on each other, and it quickly turned into a vicious cycle where pain worsened and so did the ability to sleep, which in turn increased the person's fatigue. This is the perfect example of what we're talking about today, where these conditions not only deal with only one symptom, but there are many different symptoms feeding into one another. And if we don't keep them under control, they can unravel and worsen the condition. Okay, so going back to the example, the doctor sees that the current treatment plan that this person is on is not the correct one and modifies the treatment plan. This person keeps on tracking the symptoms, and on the next visit, they see that the sleep has improved, pain has decreased, and fatigue has decreased. So they know they are on the right path. This is what personalized medicine does. It brings in factors that have been difficult to track previously, and in turn improves the interaction between patients and doctors and how patients are being treated. This is why managing an autoimmune arthritic disease is managing two different sets of symptoms, those that can be seen and those that can't be seen. And those that can't be seen, you're the most important piece of the puzzle to relay the information to your physician so that you can get the best help possible. Okay. So now that we spoke about personalized medicine, let's talk about precision medicine. What is precision medicine? Precision medicine takes the most advanced information about a disease and tailors it for an individualized treatment. Precision medicine looks at what types of patients would respond better to a specific treatment than another. The end goal of precision medicine is to get to a point where you take a simple test and it comes back and it tells you the exact medication you should take or the disease that you are most likely to get and what treatment to start to prevent this from altering your life. Basically, it wants to get to a point where it can keep healthy patients even healthier by preventing diseases. Now, unfortunately, we're not there and won't get there for a while. But part of precision medicine is already something that is happening today. This is exactly what is happening when your doctor is looking at your lab results and analyzing whether a treatment is working for you or not. This can also be by looking at how it affects people diagnosed with the same disease condition, but with different disease markers, such as whether a patient with rheumatoid arthritis has a positive rheumatoid factor or not. It also looks at inheritance. Currently, research is telling us that there are certain ethnicities that are affected by an autoimmune condition more than others. And we don't know many of the reasons why yet, but there is current research on this. And finally, it's the genetic makeup of each patient and the minor differences that cause a specific treatment to function for some and why it doesn't function for others. So let's simplify this a bit more. Let's focus on rheumatoid arthritis. Within rheumatoid arthritis, there is a specific, let's say it's a spectrum of patients that are not the same and don't react to the same medication as others. Also, within rheumatoid arthritis, there are some that are diagnosed with seropositive rheumatoid arthritis and some that are diagnosed with seronegative rheumatoid arthritis. Seropositive rheumatoid arthritis are those that are those patients that have a positive rheumatoid factor and or are anti-CCP positive. These are lab tests that rheumatologists order when they suspect that the person has an autoimmune condition. A seronegative rheumatoid arthritic patient are those that have negative rheumatoid factor and are also negative for anti-CCP, these tests, but they are still diagnosed with rheumatoid arthritis based upon finding other characteristics of rheumatoid arthritis based on certain established criteria by the American College of Rheumatology. There is ongoing research that is showing that these two types of patients deal with treatments very differently. And although more research is needed to identify all of these differences, this is an example of how the same diagnosis sometimes needs a different treatment plan. So when we talk about precision medicine, we can talk about this aspect which falls under something called pharmacogenomics. This is the study of the differences in our genes and how they affect whether a drug treatment will be successful or have serious side effects. And it also tries to see how we can use this information to customize treatments for individual patients. To try to simplify this even more, what we did is the drugs that are used to treat these conditions are chemicals that act like a specialized key that recognizes a specific location, usually a receptor, on cells in our body. We can think of these receptors as the lock. Now, if you are a seronegative RA patient and don't have the overactivity of specific markers that a seropositive rheumatoid arthritis patient has, then the treatment might be different. Our DNA determines the shape of that keyhole in the lock, and through this, we can determine what drug or key best works for that particular patient. As I mentioned earlier, we did an in-depth webinar on the topic of the differences between DMARDs, which you can access on creakyjoints.org, or you could also, I'll leave my email at the end of this webinar, and you can reach out to us for the link for more information about these drugs. Okay, let's try to go over personalized versus precision with an analogy. Do you like cilantro, Shilpa?
Yes, I absolutely love cilantro.
That's great. I also love cilantro. But what if I told you that there are people that hate cilantro because of the taste?
I've heard something around that, and I was wondering if I've always wondered if that has to do with preferences or if it has to do with your genetic makeup.
Yeah, well, sometimes it's genetic and sometimes it's preferences, right? So if you're like these people that it is for a genetic reason, you have a higher sensitivity to aldehyde chemicals, which contribute to the flavor of cilantro. And this increased sensitivity to aldehyde makes the flavor of cilantro taste like soap. Bear with me here. I'm going to get to precision and personalized medicine. But that is only one of the reasons why someone might dislike it, because of this genetic reason. Another reason, like you mentioned, Shilpa, might just be that they just genuinely don't like the flavor. Let's say I were to host a dinner party and knew that one of my guests had a genetic sensitivity to cilantro. I would avoid using this herb because I wouldn't want that guest to have an unpleasant experience. So there, I would be using what? Precision, right? If I was hosting that same dinner party, but one of my guests simply didn't like cilantro, and it was not for a genetic reason, but because it simply grossed them out for one reason or another. I don't understand why that would be, but I would still take what my guest likes and dislikes into account and tailor the dinner party to make sure it's an enjoyable experience for that guest. And this would be personalized. So as we can see, both precision and personalized are a means to improving the outcome. They're very different, but both very important. Okay, so to summarize, personalized medicine takes into consideration different assessments to find the best treatment for you. And the examples of these assessments are patient-reported outcomes, questionnaires in the doctor's office, and your own preference. Another way of seeing this is that personalized is devising a different treatment for each individual patient. This, compared to precision medicine, which precision medicine takes into consideration things such as labs, hereditary information, and individualized genetics to find the best treatment for you. It focuses on classifying individuals into subpopulations that differ in their susceptibility to a particular disease. So as you can see, precision and personalized medicine work jointly to optimize your treatment in different ways, and it is in the best interest of your physician and yourself to embrace both of these and work toward the best treatment plan. Okay, so now on to the questions.
Wonderful. Thank you so much, Dr. Hernandez. It's a really fascinating topic, and your example of this with the cilantro was particularly fascinating. We have quite a few questions.
Oh, there are. Okay, great. I just wanted to say that I was a little nervous about that cilantro analogy, but I'm glad that it was clear.
Yeah, no, it helped to understand these two very complicated but powerful terms, and it's a fascinating time in medicine, particularly when we see both preferences, patient preferences, and values being brought together with precision types of features like blood tests and genetic testing. So we have quite a few questions that have come in, and I will try to, our first question, actually, I'm going to try and combine a couple questions for the first question that we have for you, which basically asks if precision and personalized medicine mean that I, as a patient, can know exactly what medicine to take for me so my disease gets better. So let's imagine I walk into a doctor's office. If precision and personalized medicine were to work perfectly well together, the doctor would know from doing a lab test, from doing genetic testing, and from speaking to me exactly what medication to administer to me. The flip side to that question that we got, which was really interesting, is does that also mean that I would know what medicine not to take? Can you talk a little bit to that?
Sure. Yeah, as you mentioned, both precision and personalized medicine take many things into account and work together to find the best treatment for that particular patient. And unfortunately, currently this treatment plan is many times found through trial and error. And precision medicine, through their advances and through studies like pharmacogenomics, this is where they want to get to, right? They want to focus all of these different tests to identify the best treatment quicker. So there are many research projects and many scientists getting together and trying to identify these nuances from patient to patient in order to identify which medication works for them and which medication doesn't work for them. It's very early, but there are already publications out there, and obviously it's in the best interest of the person diagnosed with a condition to go speak to their rheumatologist or to whoever is treating them and talk about the most advanced publications out there and see how it can apply to their specific diagnoses and using their labs as well as everything that we spoke about today.
Great, thank you. And I think you preempted a next question that came in from the audience. And this is a concern for all patients. We all wonder why go through that trial and error process, right? When we're first diagnosed, trying one medication with the possibility that it's not going to work, and then trying to get onto another medicine, jumping through hoops all the time. Why not just go directly to genetic testing? Is that available in rheumatic and musculoskeletal diseases, or are we still at very early days for that?
That is a great question. We are unfortunately at a very early stage for that. There are some diseases that can happen. I mean that this can be a go-to, but the majority of the conditions that we're speaking about today or we're focused on today, that still isn't a go-to test to take. It's because of the lack of research that is still needed, as well as the price, right?
Wonderful. And I think, again, I would urge people in the audience to refer to the previous webinar that Dr. Hernandez did, where we talked about also, and Dr. Hernandez, please correct me if I'm wrong here, where we talked about the different inflammatory pathways that might be involved in diseases like rheumatoid arthritis, which we're still understanding. So there's still a lot of research that needs to be done in understanding what pathway is activated in which patient. Is that correct as well to say?
Yes, that is correct.
Great. We have a lot of questions coming in, and I promised the audience that I will try and get most of those questions in. But if for some reason we're unable to get to your question, we will find a way to respond to your question, either via email or by doing an additional component where we respond to your questions and post that online. So please bear with me. Another question that's come in asks about genetic tests from direct-to-consumer companies. Is this precision medicine? The person asks if these kind of genetic, you see these ads all the time on TV about genetic kits and getting your genetic testing done. Would this qualify as precision medicine as well?
That's a great question. Yeah, these direct-to-consumer genetic tests are still fairly new, and there is still a long way to go in order for this to be implemented fully as part of a precision medicine treatment plan. I was actually reading an article today that was analyzing it wasn't looking at the direct-to-consumer genetic test, but it was looking at how physicians were actually looking at them. And there are some slow adopters out there, right? And that is usually the case in medicine. But what these tests can do is it can help spark a conversation with your healthcare provider about the diseases that these tests show. And also remember, and this is what we always say, that it's always important to get a second opinion for life-changing diagnoses. So if you do decide to take one of these tests and something comes up, it's not a full 100% diagnosis. It's always very, very important to go and speak to a physician and make sure that you do the due diligence before assuming, let's say, the worst, right?
Great, thank you. And that has to do with we did read on this several articles that said that there tends to be a lot of false positives, which means you might get a diagnosis for something that you might not have. And so it's always important to go back and talk to your physician, your rheumatologist, or your clinician before assuming anything.
Yes.
Great. Another question actually connected to the genetic testing from direct-to-consumer companies has to do with information, data, and privacy. So a lot of our patients, in our community as well as outside the community, are always concerned, and rightly so, about information sharing. Does this qualify the information that is, I guess, revealed through these direct-to-consumer companies for genetic testing? Does that qualify as patient identifying information? Can you talk a little bit about this as well?
Sure. So before I answer that question, let's just state the facts that precision medicine involves analyzing highly personal and sensitive data. So that is very important for anybody that's thinking of doing these direct-to-consumer genetic tests, that they are very aware of, right? And yet, while there are clear clinical benefits to the patient, this also introduces new risks to the patient privacy and how patients are potentially vulnerable to the misuse of their genetic information. And we were looking into this because this is something that interests us very much. And we saw that in 2008, Congress passed the Genetic Information Non-Discrimination Act. It's GINA for short, JINA. And what this does, it restricts the access of health insurance companies and employers to the individual's genetic information. It also prohibits genetic discrimination, and concerns remain as to the use of genomic information to discriminate against applicants for lifelong term care and disability insurance, and these can be used to deny someone if they are more prone to something that might lower their life expectancy. So that's one of the issues that this poses now that genomics is becoming more mainstream. Also, HIPAA, which is the Health Insurance Portability and Accountability Act, this does protect patient privacy by restricting the sharing of patients' medical information, but it's so early on, with specifically for genomics, that there are many things that are in the gray area, and we're looking into it. And as soon as we get more information on how this might affect patients, we'll communicate it with you guys.
Great, thank you. And it's a really important question that came in from the patients about the issue of privacy and information owning. And we at Creaky Giants, we're big advocates for informing patients about the right to their information and the right to know what information is being used, whether that's in research or otherwise. Thank you for answering that question. Another question that comes in from the audience is if or not precision. So we've talked a little bit about precision medicine helping us with treatment. Can it and with specifically tailoring custom-made, so to speak, treatments for a specific patient, but can precision medicine also help with prevention?
That is a great question as well. And as we had mentioned, this is a goal of precision medicine, right? It's to make healthy patients healthier. So we spoke a bit about pharmacogenomics earlier, but we can expand a bit more on it now. This is finding the ways to tailor. So pharmacogenomics is finding ways to tailor a medication and the dose to a person's genetic makeup But the way that it's happening is through the study of something called SNPs, which are single nucleotide polymorphisms. SNPs are SNP. And these might also eventually find ways to predict diseases, not only identify the pharmacogenomic side of it. So according to the NIH, the National Institute of Health, now that the sequence of the human genome has been discovered, the next stage of genomic research will begin to derive meaningful knowledge from these DNA sequences. So these SNPs are the most common type of genetic variation, so they're studied very closely. And these small differences may help predict the person's risk of a particular disease and their response, obviously, to a certain medication, which is pharmacogenomics. There are roughly 4 to 5 million SNPs in a person's genome. So you can imagine it's quite labor intensive to study these, but those variations may be unique or occur in many individuals, and scientists have found more than 100 million SNPs in population around the world, and how they and some differences between them. What these can do is that they can act as biological markers, and these can help scientists locate genes that are associated with diseases. So, as I mentioned, researchers have already found SNPs that may help predict an individual's response to certain drugs. They have also found some that have shown susceptibility to environmental factors such as toxins, and also risk. And they've also found some SNPs that identify risk of developing particular diseases. So these SNPs can be used to track the inheritance of disease genes within families as well. What this is going to do is that this is going to lay the foundation for predicting disease susceptibility and drug response. And so it's very exciting. It's a little complex, but just remember, SNPs, SNPs, those are the major factors in genomics research right now. And it's focused on pharmacogenomics, but eventually it will find its way to identifying the diseases way before they actually present themselves.
That is really interesting. And I want to bring up at this point a fantastic comment by someone in the audience. Thank you, Cinta, for this comment. And Cinta says that genetic information, whether you're doing this through direct-to-consumer companies or in some other way, may also involve outing others in your family. So, when you're doing genetic testing, it's not just about you, it's about other members in the family, since we are looking at the genetic makeup, etc. And so, there's some very fascinating questions that are coming up around in this field of precision medicine, genetic testing. I suppose that we still need to think about very carefully as we proceed forward in this field. Any comment on that, Dr. Hernandez?
Yeah, I think since the study of genes has started years and years ago, these ethical questions have always been posed to the scientists studying them, right? So if you know that your newborn is prone to a certain disease when they're 30, will you make a decision before that newborn is born? Or another example is if you get an exam where you identify that your whole family is more prone to a cancer, is it up to you to tell everybody about this higher prevalence in your family? So there's a lot of these little nuances that ethical nuances that are being discussed, and we really don't know I really can't get into my opinion on it because I don't have one, but I think it's very important that while this is happening, all of these questions are constantly being asked, and there is a discussion between everybody that will be affected and how to move forward with these studies.
Great, thank you. And I suppose that is the field of bioethics as well as the ethical implications as we move forward in science and in research, the ethical implications of, I suppose, progress in research, especially with something like genetic testing. Um, I want to take a moment to pause here. We have a question about ankylosing spondylitis in the audience coming in from Jed, who asks how can he better empower members of a support group advocate for themselves when they are HLA negative, and the doctor does not want to provide a diagnosis of ankylosing spondylitis. And it's a really good question, especially Dr. Hernandez, you talked about seropositive and seronegative rheumatoid arthritis as well, clinical manifestations, and then manifestations in the blood, etc. And I do want to pause a moment here and say that we invite you to join our next month's webinar, which is on this topic, on the topic of ankylosing spondylitis, and might be a great forum to ask our speaker there, who is an expert on ankylosing spondylitis specifically, to ask her this question as well. But I didn't know if, Dr. Hernandez, you might want to relate this back to rheumatoid arthritis, the seropositive and the seronegative spectrum of patients. How can we advocate for patients who might not be seropositive, who might not show a positive rheumatoid factor in their blood work?
Yeah, that's a very important question, and one that we get a lot. And the advice that we can give you is the empowerment is by educating yourself, figuring out exactly the diagnosis, the symptoms for this particular disease, so that when you do go to a rheumatologist or a healthcare provider, you can have that one-to-one discussion and figure out what the best next steps are. Right? If you go in equipped with knowledge, the discussion will be a lot more back and forth instead of just a one way and feeling like you're not being heard. So we obviously have many resources for this. If you would like to email me, I would love to get you in contact with our community, as well as link you to some resources that can help you and your community.
Fantastic, thank you. And I'd like to just reiterate that educating yourself, you're the patient, you know best your body and what's happening to it, and tracking what's happening to you over a period of time is another really powerful tool to use when you go into your doctor's office. We have a question also about insurance, and I'm not sure if we have the answer to this, but if insurance would cover for genetic testing, would you happen to know about that, Dr. Hernandez? Or if not, we can always direct the person in the audience to someone at Creaky Joints who might be able to provide answers about the insurance component of this question.
Yeah, it's case by case basis. Obviously, if your physician feels like it's very, very necessary for a diagnosis, then it might be covered. But I would we can get in touch later, figure out exactly what insurance you have and why you're asking that question, and then we can go from there and help you out.
Great, thank you. And again, a thank you to a member in our audience who Cynthia again, who talks about All of Us, which is a program at the NIH, the National Institutes of Health, of which she is a participant. And All of Us comprises patients with RA who contribute blood work, blood samples, etc., so that we can advance understanding in rheumatoid arthritis, creaky joints, arthritis power. We do work with academic institutions, with hospitals, healthcare systems, and also with have worked on NIH-funded awards, and we support. We're big supporters of the National Institutes of Health, who incidentally, I might add over here, it's the National Institutes of Health actually who developed the PROMIS measures, or the patient-reported outcome measurement system, or the PROs, as you might have heard of them, which are part of Arthritis Power. These are assessments that patients can use in order to track their disease, but they are also assessments that you can share with your doctor, with your loved ones, especially for things that are not seen in your blood work, like pain and fatigue. So thank you for that piece of information. We have another question on genetic testing and precision medicine, Dr. Hernandez, for you. This question asks if there are certain diseases that precision medicine can work better for versus others. Is that something you could talk about?
Sure. As we previously mentioned, precision medicine is more advanced in some diseases compared to others, but the hope is that all diseases will benefit from these eventually. There's already the case with a few cancers and diseases. There are a few examples of this happening, such as when Angelina Jolie underwent a double mastectomy after learning she carried a gene mutation. She found out that this gene mutation might put her at greater risk of developing breast and ovarian cancer, and that's the reason why she did the procedure. Though she wasn't diagnosed with cancer, she went ahead and did it as a preventative measure. But it is important to mention that this was not the only reason why she underwent this procedure, and it also included many consultations with experts. So there are some cancers and diseases that are more advanced in the research and linking them to genomics, but the hope is that eventually all the diseases will be able to be identified this way.
Great, thank you. You alluded, Dr. Hernandez, to seronegative and seropositive rheumatoid arthritis. Someone else has asked us in the audience, which I mentioned before, about testing negative for the HLA gene for ankylosing spondylitis. I guess the question is if there are differences in treating someone who is seronegative versus someone who is seropositive. Do we know that, or is that research still currently underway, and we don't have clear answers as far as that is concerned?
There are very exciting new research out there that defining these two, but it is a case by case basis, like many of the diseases that we deal with, unfortunately. So if I do give an answer, it might be taken the wrong way. So what I would recommend is you go to your rheumatologist and ask him or her about the newest articles out there on this, and have a discussion about that with them. I'm sure it'll spark a great conversation.
Great, thank you. You might, this is something I think a little bit more clarification would help. Someone in the audience asks if drugs today the different medications that we have today can be tested via DNA for adjusting medication dosage. So rather than adjusting medication or tailoring the specific medication for a specific patient, can dosage adjustment also be something that can be addressed through precision medicine? Is that something that's being currently studied or not yet?
Yes, absolutely. That is one of the the things that are being studied with pharmacogenomics. So that is a very important part of this type of research, and eventually everybody that has to take a medication will be able to get their specific dosage based on their genomics. So it's very exciting. It's something that's very exciting, and it's getting the scientific community very, very, very excited about as well.
Wonderful, thank you. Very interesting sort of wrap up question coming in from someone in the audience is what do you see as the future of medicine given precision and personalized medicine? Dr. Hernandez, I'll let you have the last comment on that.
Thank you, Shilpa. I think we are already in the beginning of the future of medicine with personalized and precision medicine. There are so many different tools that are already out there to tailor a medication or tailor a treatment to a specific patient. There are obviously many exciting things coming, but it is in the best benefit, like I mentioned earlier, of everyone to use the tools that are available right now, such as patient-reported outcomes and being as educated as possible with about your disease and about the newest the newest research about your disease in order for or your condition in order for you to be the most empowered you can be, and that's the final word.
That's fantastic. I know I said that was the last question, but I promise you this is the very last question, and then we will wrap up since we're right at the coming to the top of the hour. Is how do you advise patients to have conversations around what we've talked about today with their doctors? You talked about personalized medicine and talking to your doctor about the importance of shared decision making, tracking your disease, communicating to your doctor what your doctor might not see on a blood test, things like pain, fatigue, etc., especially for the disease conditions, like inflammatory arthritis. Is precision medicine, are conversations around precision medicine happening as well with doctors? Are doctors, clinicians aware of these advances? Can patients talk to them about it? Is there any last word of advice to our audience?
Absolutely. So shared decision making is one of these things that we mention constantly throughout the webinars that we have and throughout everything that we do, because it is very important. Having that dialogue with your rheumatologist or whoever is treating your condition is very, very important. And once you develop this dialogue and you become a part of your treatment plan, it'll be much easier to have discussions about the newest and the things that your rheumatologist is learning at ACR or at these conferences, where many new and exciting information is constantly being projected and they're learning about. So yes, it is very important to have these conversations with your healthcare provider or your rheumatologist in order for you to be at the cutting edge of precision and personalized medicine.
Fantastic. Thank you so much, Dr. Hernandez. That was it's a very hopeful tone to wrap up today's discussion. And certainly a very exciting time in medicine. For us all as patients, I think it would be a very, very important leap if we were able to tell what medication would work for each specific patient. So that is our hope for the future. And we hope that someday we will get to that future, if not in our for us, then for the generations to come. So thank you also to our audience for attending today's webinars, especially for your comments and questions throughout the webinar. Please note that this webinar, like all our other webinars, has been recorded. And so if you were unable to listen to the entire recording, or if you wanted to share it with someone, or if for some reason you wanted to revisit it and review some of the information, you can access it online on our website on creakyjoints.org. Please also join us for our next month's webinars. So we host webinars every month on various different topics. Our next month's webinar is on the topic of ankylosing spondylitis, and we will be sending out more information, how to register for that webinar shortly. So finally, for making today's webinar possible, we would like to extend our sincere thanks to Sanofi Regeneron and to Dr. Hernandez for a fantastic talk. Thank you very much, everyone, and have a lovely rest of your day.